Hi, my name is Christine Sørensen. I'm the Health Literacy Trailblazer, and I want to record a short videograph about what gets measured gets done. I'm inspired by a recent visit to Lisbon. I was attending the European Public Health Conference, also called the EPH conference. And after the conference, I had a chance to visit some of the sites in Lisbon, and it was fantastic. We were walking around in the sunshine at the seashore, at the harbor, and suddenly we saw a big sign saying Museum of Art, Architecture and Technology. And as you know, I love health literacy by design. So we had a stroll in there. First, we saw the art museum. It was absolutely stunning. It's a fantastic building. And afterwards, you have to go to another venue to see the technology museum. It was an old power plant, and in those installations that are all there, I found this old meter, and I took a picture of it, and it reminded me of health literacy measurement. As some of you may know, I've been involved in health literacy measurement since the beginning of my journey, of my quest on health literacy. In 2009, I was asked to coordinate the European Health Literacy Survey, and we had to develop a whole new measurement tool. And some of you may know it, it's called the HLS tool. But in that quest, I also met with many different colleagues from around the world, and we were at the HARC conference, which is the annual research conference in the US. And I met with American colleagues, and we're discussing all these types of instruments to measure health literacy and what was their purpose, what were the strengths and weaknesses, and we had some panel discussions. And afterwards, we decided to map all the health literacy tools. And you can see an old clip here from our publication that was published in 2014. And at that time, we were able to identify 51 instruments to measure health literacy. We also discussed with Michael Parciolo, one of our co-authors, that it was actually quite a hassle to go through all the publications to find relevant measurement tools on health literacy. And he came up with the idea to make a database. And I love this database called the Health Literacy Toolshed, because that is the place where I can go and look for relevant tools to measure health literacy, no matter what project I am engaged in. And this is what I recommend people to do when they ask me, how are you measuring health literacy? And I know that many people, they would say, oh, you automatically do and take the HLS tool, the Health Literacy Survey tool. But actually, no. My recommendation is that you start with these three questions. First, what is your research question? What are you going to study? Which dimension, which perspective? Who and what do you want to measure? What target group? What's your audience? Is it about patients? Is it about children in schools? Is it the health literacy at work? It matters for which measurement tool you want to choose. And then I would go to the toolshed to look which tool is relevant in the health literacy toolshed. And then I would have a selection of tools to choose from and discuss with my research group which one do we want to choose. So I don't do it the other way around, starting with the tool and then come up with a research question. It's I think more appropriate to actually look at your research question. What dimensions of health literacy do you want to measure? When and why and how? And when you have that full picture, you can dive into the health literacy toolshed and find a relevant tool. And we're all here to help you. There are so many tools. I think at this point more than 250 tools. And there are some nice search functions, and you can always reach out to colleagues here in the health literacy community. We're here to help. Thank you for your attention, and I wish you good luck in your project, and what gets measured gets done.